certified cancer exercise trainer. I currently am employed as an exercise physiologist at St. Luke's Mountain States Tumor Institute. I work for the Integrative Medicine program as their lead physiologist working in the oncology rehab program. I work with a large volume of cancer patients who come in pre-treatment, during treatment, and post-treatment. And currently at Misty, in my program, we're working on an investigation with bone marrow transplant patients, which typically include multiple myeloma or lymphoma patients. And preliminary results, we do not have any statistical analysis because it's a small population. We maybe see 30 patients a year. But preliminary results are we're finding that hospital admissions have been decreased by 1 day. And that's very exciting to us and the program. But through some verbal feedback, we're also finding through our exercise program that patients who are receiving a bone marrow transplant are tolerating treatment a little more efficiently. And that's something that is also very exciting to us. Before I begin about exercise testing and some limitations, I'm going to go through a few things that I feel are important about exercise and cancer, or for cancer survivors. But here are a few recommendations that I would like to put out there. The first one is the ACS Certified Cancer Exercise Trainer webinar. This is something that if you are looking to become a cancer exercise trainer or be in the field working as a physiologist or a trainer in exercising cancer survivors, this is a great webinar. It's very informative and it has a great deal of information that I can only touch on in this webinar today. But something that I would recommend is understanding cancer on a cellular level. Something like initiation, promotion, progression, and metastasis. I think it's important to have a functional idea of the progression of cancer and then possible metastasis sites, and then just kind of how cancer even develops in our body. But this webinar also goes in through treatment types, from the effects and side effects of radiation therapy, chemotherapy, immunotherapy, surgery, and I think those are definitely not within my scope to understand how to do the surgery, but it's a good idea about maybe discussing it with the surgeon or even the patient about the type of surgery that they had, and then definitely having a general idea about the treatments. And then post-treatment symptoms. That's very important to understand what happens afterwards. It's hard to be empathetic with cancer survivors if you haven't had cancer, and that's something that I can't empathize with my patients. I do understand pain. I've been in a horrible car accident, so I find that when I do discuss pain with them, a shattered pelvis that I had, I think that usually opens the door for a little bit more discussion on their treatment side effects. But you better know what you're at least going to say to them when you're talking about it. I also recommend the ACSM Roundtable on Exercise Guidelines for Cancer Survivors. Now, this is a position statement that the ACSM put out, and it regards nutrition and exercise, and basically their position stance on for guidelines for the cancer survivors. It's very important and it's a great read. I also recommend visiting the National Comprehensive Cancer Network. These are clinical practice guidelines. This is a statement of evidence and consensus from the authors regarding their views and currently accepted approaches to treatment. Great read as well, and very important that these are very research-oriented and scientifically backed readings that I recommend. And at all times, talk to the physician, talk to the oncologist. I know they're very busy, and it's going to be very difficult to get them to respond a lot of times, so then I recommend going to the nurse. Nothing better than a nurse. Nurses are great. They're angels that are there for all patients. I'm married to one, who is an oncology nurse. I bug her quite frequently about treatments, types of cancer, stages of cancer and the progress of the cancer. And quite honestly, sometimes I'll ask if a patient's going to survive or not. And it's great to have that resource for myself that helps me become helps me be a better physiologist for cancer survivors in training. Nurses are great, and nurses are always open to talking. And then a nurse practitioner, they're the same. At one point, they were a nurse typically. And so I recommend that if you are going to start working with cancer survivors, to start with the nurses or nurse practitioners to get some recommendations on exercise, and then also treatment side effects and anything else that might go along with it. This slide is just something I wanted to touch on that you can see. In the year 2020, there's going to be an estimated number of cancer survivors at 20 million. This is a call to arms, basically, is what I like to look at it as, for physicians, for anybody researching cancer and exercise, and then also for anybody working with cancer patients. This population is growing and they need attention, and they specifically need attention, I think, from our physicians and the healthcare, because exercise can be an adjuvant therapy for cancer patients. When it typically happens, I see, is their functional capacity decreases, and there's only one way to increase that functional capacity, and that's through exercise. 20 million. This slide here is an idea about what types of cancer is out there right now, and the percentage of that population. And as of January last year of 2014, there were an estimated 14.5 million cancer patients. So that's quite a bit. And the slide what I take from this slide is it's not all breast cancer patients. And I don't mean any disrespect towards breast cancer patients, but what I am noticing is a lot of the research is directed at breast cancer patients, but I want everybody here to know that it is not all breast cancer patients. There are a lot of others, survivors, that need our attention. And from what I see a lot of is, like I said, the bone marrow transplant patients, the multiple myeloma and the lymphoma patients who at some point, some of them do 30 days in a hospital environment or inpatient, where if we could get them stronger before they go in, prehabilitation, before they go into the hospital inpatient stay for their transplant, they can come out maybe a little bit stronger, or they can even tolerate the treatment while they're inpatient. We've got to get them to move. Non-Hodgkin lymphoma patients are another one that definitely will have some muscle wasting and some effects from their treatment. And I think that it's important from this slide that we understand that there are a lot of other individuals out there that we can help and take part in, and exercise is important for them all. So how are we moving currently? These statistics are from some breast cancer research that I took out. 65% of breast cancer survivors are not meeting the physical activity recommendations 6 months post-diagnosis. And so right now we all know through the ACSM that 150 minutes a week of cardiovascular exercise is recommended. So 30 minutes a day, 5 times a week. 65% of survivors, breast cancer survivors, are not meeting those physical activity recommendations. Less than 8% of long-term survivors meet actual guidelines. The mortality rate dropped 34% in those that were very active compared to inactive in breast cancer survivors. And you see, as I continue to say breast cancer survivors, it would be great to get more research on other cancer survivors. I think we can make a difference. Now, a couple of modifiable risk factors I think are important that we can look at. Modifiable risk factors give individuals a place that they can make changes in their life that can affect their overall health and their risk for recurrence. As you can see that if you are working with the cancer survivors, weight, physical activity, and diet, modify them, we can help prevent certain types of cancer. Now, I was in a moving on class here presenting on exercise a couple weeks ago, and I actually said this slide here, and it got me in a little bit of trouble, or a little hot water with one of the patients. Now, she was running marathons, eating like she was supposed to, using MyFitnessPal to document her nutrition, running every day, staying healthy in a very good weight, and she still got, she still was diagnosed with breast cancer. Modifiable risk factors or these changes is not a silver bullet. It's not the magic bullet that's going to stop cancer from occurring, but we can do a lot of things to decrease our risks, and that's staying healthy, maintaining a positive weight, and modifying our diet to eat a little better and doing better for ourselves. So as a personal trainer or an exercise physiologist, I think that's our responsibility to help out with our healthy individuals, as well as sending this message that we want to maintain a good body weight, increase our physical activity, and modify our diet, eating healthier. So what we know already about cancer and physical activity, inflammation. Chronic inflammation is linked to cancer. And as an example of that, rheumatoid arthritis or even Crohn's disease has been linked to cancer. And we know that exercise can help decrease some of our inflammation. As an example of that is, as an exercise physiologist, if we ever have knee pain, we put them on a bicycle. And why do we do that? To decrease or promote circulation so we can decrease inflammation. Chronic inflammation can be helped through exercise. Adipose tissue. Decreasing adipose tissue decreases the risks of developing cancer. I work with another physician now that is kind of pioneer, or is a very staunch advocate of childhood obesity. And what he's recommending now is that trying to get ahead of the childhood obesity, because one day our population, and what Liz and I were just talking about, 68% of our population is overweight. So if adipose tissue or obesity is leading to cancer, certain types of cancer, I think it's important that we try to decrease it. But what the physician was saying, getting back to that point, is that childhood obesity, as the children age, they're going to outnumber the number of physicians that we have addressing these comorbidities that come with obesity or increased adipose tissue. And obesity is leading to a lot of comorbidities, as diabetes, heart disease, and cancer. And if we're running out of physicians, we're not going to be able to treat them. So as an exercise physiologist or a personal trainer, I think that it's also important to go out and get in front of individuals and press this issue, this topic. Immune surveillance. This helps keep us healthy. Physical activity allows us to increase on our immune system. And that's kind of what we're doing about cancer now, is that putting certain treatments, immunotherapy, is increasing our T cells to fight certain types of cancer. Exercise can increase our immune surveillance, and it can help fight certain types of cancer before they even begin. Maybe that mutation is starting to develop. Exercise can definitely help decrease some of those issues. But my favorite, autophagy, or autophagocytosis. This goes up with physical activity. Autophagocytosis or autophagy is the degradation and recycling of our cellular components. Autophagy is a mouthful, so is autophagocytosis, and everything else I just said regarding it. I'm very proud of myself for being able to say autophagocytosis and autophagy. It took me a while. As we exercise more, autophagy goes up. We're able to clean out those dead cells or the cellular components that are left behind. And if regulated, we can ensure synthesis of our cells. So it's important that we understand that physical activity can help increase or decrease inflammation, extra adipose tissue in our body, can increase our immune surveillance, and then that important one, autophagy. So the importance of physical activity for cancer survivors, this was, this has been beat to death in my opinion, but I just need to touch on it before we get to the testing and limitations. But physical activity can reduce nausea, it can prevent weight gain, and working with a lot of cancer survivors, we know that with the nausea, it's easy to brisk walking, especially during treatment. With the physical activity, we can prevent weight gain, reduces body fat, reduces disease risk and recurrence. And as I've already mentioned, those are pretty important adjuvant therapy for cancer, pre-cancer survivors. We also know that through the research that this may reduce the risk of recurrence by up to 30%. So that's pretty important. I think that in addition to our treatment and some of the treatment post-exercise or post-diagnosis, along with physical activity, can increase that recurrence rate by maybe 40 to 50%. So the ACSM, and this comes out of their guidelines for exercise testing and prescription book. It's a great reference that I would also recommend getting. For the general medical assessments recommended prior to exercise, well, I would recommend to evaluate peripheral neuropathies, musculoskeletal morbidity secondary to treatment. But it's also recommended that if they're on any kind of hormone therapy, to evaluate for risk fractures or fracture risks, any kind of cardiac conditions secondary to treatment. There's always a risk for metastasis and for bone issues. I find a lot of times that the spine is a very difficult one with exercise, especially during testing if you're doing any kind of strength tests, to watch out for the bone issues. And a lot of times patients will let you know about those, and we'll get into a little bit about the health history as well. But for specific cancer site-specific medical assessments, it's recommended that we can divide it up into certain groups with breast cancer patients, survivors, assess their range of motion in their upper body. Prostate evaluation of muscle strength and wasting. For the colon survivors, should be evaluated as having established consistent and proactive infection prevention behaviors. And watch out for the ostomy as well. Those are difficult to deal with. No abdominal pressure, and so forth. So this is a great pre-exercise medical assessment for individuals with cancer. Exercise testing, I believe, is extremely important for prescribing a progressive exercise program for cancer survivors. Now, if they're basically just starting out, it is not recommended, or it's not as important to have an assessment to start a light intensity walking, progressive strength training, or flexibility program. Typically what we find is that when during treatment, it's hard, and I've been told this before from a physician, that when a patient is diagnosed, there is so much that goes on in their minds, and with visits with nurse practitioners, with the physician, with chemotherapy or their treatment with the surgeon, that exercise is going to be the last things that the physician recommends. It's one more appointment they have to go to, and that's very difficult. So if you ever come across a patient that's saying, hey, I just need to do something, a gentle walk in the woods is always a great option. It's dependent on the type of cancer. Like myeloma patients, they're not able to go into a pool because of immune risks, but walking outdoors is always nice. Here in Idaho, they have some river trips that they're able to go on, down some gentle, easy rivers, or even a fly fishing group. Just something that gets you into a group environment is always important. So for exercise testing, also be aware. Recommendation, check their health history. And this is something that you can typically get from the nurse or the physician. If you have access to the medical charts, it's important. Patients will forget surgeries. They will forget pain that they're having in places. You have to ask, did you have surgery? And if it wasn't a type of surgery for their type of cancer, they may have had surgery when they were young that can definitely have some effects today. So it's always important to ask them more than once. Where did you have the surgery? If it's a breast survivor, did you have any lymph nodes removed? How many? Which side? And they can get that sometimes confused. A lot of times I have seen patients will not know what their primary cancer is. And once it has metastasized to the bone, they may call it bone cancer. Well, it's that bone cancer is kind of a vague term. Where did it start? And a lot of times, some patients just don't remember, and that's important to kind of get that health history. But also look for any kind of history of heart disease, those comorbid chronic diseases and health conditions. Check their range of motion, check for exercise contraindications, which we'll get in here a little bit. But also try to get that level or medical history from the physician, as I said, but also find out about their gym routine. What are they currently doing? What were they currently doing? I've had some patients that have said, well, I'm in good shape. I was working out maybe 5 years ago. Well, that's tough to deal with 5 years ago, but what are you doing right now? And we need to get them back in the gym, which can also be a limitation is other gyms and their cleanliness. There's no evidence suggesting level of medical supervision. It's always important to talk to the physician, but we're finding that a lot of our patients are dealing with just functional decrease in capacity. Their functional capacity has decreased. They're not able to move as quickly, and that can be not dealing with anemia, but just dealing with strength and their muscle wasting. And then also understand most common toxicities associated with cancer treatment, their risk for fractures, cardiovascular events, or did treatment lead to any kind of those cardiovascular issues? And then neuropathies also is very difficult to deal with. A recommendation for neuropathy is acupuncture. Acupuncture has been shown to have great results with acupuncture. With neuropathy, acupuncture has been very good helping with neuropathy. Exercise, I'm not finding is a very good substitute for decreasing certain peripheral neuropathies, especially in the feet. Balance training is definitely important. It can help them out. Now, with exercise testing, there are quite a few different types of things that you can do. With the assessment, just remember assessment is individual and prescription is individual. I'm not a big fan of group exercise training. I think that it's important that survivors work in a group, but each one of them should be at a different level of fitness, and each one of them is probably going to have their own bicep curl weight, their own leg press weight. And it's not important to just say, hey, everybody, you go do this. Assess each individual as an individual. Now, certain types of assessments you can do, 1 to 3 or 10 rep max test. I'm a big fan of these. I think that the 10 rep max test anyway. I think it's very difficult to get someone to come in and do a 1 rep max test, but it is safe if you do it in a safe environment, and you also have supervision with someone that understands how to do a 1 rep max test. Another test is an 8-foot get up and go. This is a great functional capacity test of getting out of a chair, and that's basically what it simulates. Put them in a chair, have them walk 8 feet, come back, and time them. And these are pre and post tests as well. 6-minute walk test can give you a pretty good indicator of your cardiovascular endurance. And basically a lot of times these patients are coming in from treatment who have a diminished functional capacity, and these are great tests to start out with. Balance test is always important for the older adults that you may come across. And flexibility, you can use a sit and reach test for this to assess flexibility, but also you can just use a seated in a chair, reach for your toes, sit and reach test, and then measure and post test those types of things. The type of patients that I see, we don't typically do a lot of graded exercise tests or sub-max tests on a treadmill or even on a bicycle. A lot of what I do is a 6-minute walk test, but a couple of them that I recommend, maybe the Faust protocol. I have done that with some survivors that come in and see me. I think it's a great idea to get a general idea about their metabolic equipment or their METs that they're working at, but also just their mental toughness. I find that doing the strength tests builds confidence, and specifically in a lot of the women that I have come in, they'll like to come in and lift maybe 50, 45 pounds on the leg press, but when you get them lifting 150 pounds, their typical response is, I didn't think I could do it. Once you get them to do it, that changes everything. Then they start to see the results, then they start to see the changes. Strength testing builds confidence. Make sure you have supervision as well. For us, what we're doing, exercise physiologists, PTs, or even some of the physicians, I think that supervision is important to explain maybe the heart rate reserve or the VO2 reserve or even the RPE scale. It's always important to have somebody be able to explain the results of the test or why we are doing the test. The evidence-based literature indicates 1 rep max test is safe for breast cancer survivors. And along those lines, I believe that it is safe for other survivors as well, or patients that you may be seeing. I think it is very important to start a strength training program with patients, and something that you can apply the FIT principle to. So exercise testing is one of the places that I am recommending that a great book, Exercise in Cancer Recovery, is out of the Rocky Mountain Cancer Rehabilitation Institute, which is located at Colorado State University in beautiful Fort Collins, Colorado. But they recommend body composition testing, pulmonary function, circumference measurements, cardiovascular endurance, flexibility, range of motion, agility testing, and muscular endurance and strength testing. Now, they do a great job down there. They work with their physicians very closely, and I think that they probably see a great deal of cancer patients or survivors like myself. I work in a hospital setting, so it's a little bit different than they do, I believe. I don't believe in the body composition testing as much as I think it is important to get results for data compilation or data acquisition, I guess you could say. So what I recommend for body composition testing is just getting their body weight. A lot of times, if you don't have a good system for body composition, I think calipers are a little bit invasive. And the other thing is that I work a great deal with dietitians at Misty, and their number one thing, don't starve yourself. Don't worry about your body composition. Don't worry about your body fat. You need to eat. You need the energy to survive, and you need the energy to fight. And even in strength training, we know that you can't go in and work out on an empty stomach, and we know that you cannot gain muscle in a caloric deficit. So it's important to understand that sometimes you need to take into consideration how the patient may respond to some of these tests. Pulmonary function test is important. Circumference measurements, again, I think is very important for lymphedema, especially on the arms for breast cancer patients. But I don't think it's important for survivors coming in and just trying to build on their functional capacity or just help with the treatment side effects. The ACSM recommends a balance test, agility test, speed test, flexibility test. Again, how important is agility and speed test for cancer survivors? That's probably up to you and your setting. In my setting, not important. Balance test and flexibility tests are important. As we strength train, we become stronger, we become tighter. Muscular strength endurance test, I think, is very important, and the cardiorespiratory endurance test, I think, is subject to the practitioner or what your goals may be. Now, at St. Luke's, where I run my strength training program, we do an 8-foot get up and go. This is important because I want to see how quickly they're able to get up out of a chair. It's pretty basic. I see a lot of older adults that I think I can improve on that ability, but then also we get the younger adults, the teenagers even, that they go very fast. And we want to see whether or not they're diminishing in that ability, or if we can improve on it. If we can get somebody that's 18 years old, which I've had before, come in, build strength, build their confidence, and then understand that the ability to become stronger can help decrease their risk of recurrence, and keep the cancer away for maybe another year, then I think it's worth it. 6-minute walk test, that's always a great test to do with anybody. They're briskly walking, and even if they improve on it by a few hundred feet, that's still an improvement. The 30-second chair stand is also a great test. The one-leg balance test we do there. This is important for our older adults. Typically, a lot of times the younger adults just blow that out of the water. But then also our muscular strength endurance test, which I have adapted from the Rocky Mountain Cancer Rehabilitation Institute. It's based on your body weight, age, and gender. And I think that that's a great test because cancer survivors come in a large spectrum. Initially, you can get young and old. You can get stage 4, stage 1. You can get different types of cancer, lung, like I mentioned many times, multiple myeloma or lymphoma, breast cancer, melanoma patients, head and neck patients, and every one of them is going to be different. Every one of them is going to be an individual, and that's why I highly recommend the muscular strength endurance test, because it's not something that's going to punish them right away, but it's something that's going to give you an idea about how you are able to prescribe their exercise intensity. I continue to say that working with healthy adults, we want to be careful, even elite athletes, triathletes or cyclists, we want to be careful of the vigorous high intensity. We know that, or if any of you are doing any kind of triathlons or cycling, I'm a big bike racer and triathlete, that working at a high intensity maybe after a bike race or even training for a race can compromise your immune system. So the last thing we want to do is put a cancer survivor into a position where their immune system is compromised further during treatment. And so moderate intensity is highly recommended. Conversation pace even, starting out slow. And I believe that the muscular strength endurance test allows us to do that. And I said, we do not do body composition testing. If somebody wants it, I'm all for it. I'm pretty good at the skin folds, but we also have some bioelectrical impedance machines that we can use. But as I said, the dietitians and some of our physicians, it's highly encouraged that they eat. I've had just the other day, had a patient come in, brand new to the program, not doing very well, but didn't eat in the morning. And I asked, well, she had a little bit of, her blood sugar was dropping, not doing very well, not able to get through the program, kind of asking her, well, some series of questions. Why are you feeling this way? Did you eat? No, my stomach is upset and I don't want to eat. They got to understand that they need to eat. They don't want to be on the cancer diet and lose weight. That's the wrong way about going and doing it. But I also follow the ACSM guidelines for exercise testing. Now, some limitations and barriers for cancer survivors, they're very specific. And the main one that I come across is fatigue. Fatigue is hard to explain. I think that after some of their treatment, they are diminishing that functional capacity, as I've said. As I tell a lot of my survivors that come in, they start out maybe getting off the couch and they get diagnosed, and then they go through a series of appointments, a series of bad news or even treatments, and they come in at 50%. After treatment, they may be down at a functional capacity of 30%. If you don't do anything, I tell them, after their cancer is either in remission or they've been the cancer is gone, if they're not working out, then they're not going to get back to that 50%. And that's the importance of prehabilitation, in my opinion. But they need to do something, and a lot of times, even years after they are treated, they will still have this fatigue. And this is a big limitation for survivors, is the fatigue. I don't feel the same as I did before cancer. And it makes sense a lot of times when you explain it to them as, well, you came in off the couch, you weren't doing much already, and then you were diagnosed with cancer where you had treatment, your capacity diminished. Let's build it back up and try to decrease that fatigue. Pain. Bone pain is the biggest one that you need to watch out for, some of the testing and limitations or limitations to testing. And a lot of times, like I said, it's in the spine that I have come across, is spinal lesions. And you need to be aware of those, because those can definitely, doing a 1-rep max test with someone who has spinal lesions or metastasis to the bone, that can be pretty bad and that can cause a lot of pain. Limited range of motion, that goes across the board for breast cancer patients and prostate patients. Even if they've taken any kind of lymph nodes in the genital area, then that can cause a lot of issues with some edema. and that's going to decrease the range of motion. So edema isn't just specifically, or lymphedema, sorry about that, lymphedema is not just specific to breast cancer patients. It can also be for prostate patients as well. And lymphedema is one of those limitations. Lymphedema, as we already know, hopefully you all know, is not created by exercise. It is actually, a few years ago, from my understanding, lymphedema it was recommended not to exercise. It is now recommended exercise can help with lymphedema. If you are exercising at a high intensity and it creates lymphedema, decrease the intensity. And that's exactly what we do at Misty. We have some lymphedema specialists that help out, and it's always recommended for breast cancer patients to have, or survivors, to get fitted for a lymphedema sleeve. But a lot of things can create lymphedema. It's just not exercise. And as I said, neuropathy is a huge limitation to exercise testing or even exercise. It's important that I recommend acupuncture. Acupuncture is great for a lot of things. Some additional limitations, typically they're the same as a healthy person. And that's something that I have gained from the ACSM, is that for cancer survivors, exercise prescription doesn't need to have a crazy prescription. It can be the same as for most healthy people. I just believe that their functional capacity is decreased, and that's going to be their level of fitness. This can be a limitation. Fear is another limitation of, even if it is psychological, if I've never been into a gym, what's going to happen? I don't know what's going to happen. I don't want to get big and bulky. That is the same fear for cancer survivors, believe it or not. Confidence, I think, is another one. It's kind of coming into an environment where I don't know if I want to do this. I don't even like exercise. I don't like sweating. I've had countless patients tell me that one. I don't want to work hard. And once you get them through the program of a moderate intensity, they seem to do pretty good and respond to it very well as well. Nutrition, this is a big one. As I've said, getting cancer survivors to eat is very difficult. Getting cancer survivors to eat well is very difficult. Getting the right amount of protein in is very difficult. There's countless times I would recommend to try to talk to a dietitian about it, but I have heard that for BMT patients or bone marrow transplant patients, that the neutropenia diet, I believe is what it's called, is coming up nowadays. It's a myth. It's, you can't eat this certain way for your blood cells. It's not true, and it's always good to talk to a dietitian about those types of things. Unfamiliarity with equipment. Everybody has that one. And that's why a good orientation to your facility is always important. But it's also giving the patient time to learn the machines. And what we do at my program is we allow them to have a couple of weeks just working with the machines. And then we start progressing the program. And then we also start incorporating new exercises if they have certain areas that they need to work on, or muscle imbalances, if you will. Time is another one. Patients have very little time when diagnosed. It's a tough one to deal with. That is a huge limitation if I can't make it. Idaho is a pretty small area. Boise is a small town, or small city, and we're very rural. We have a lot of individuals coming from 20 miles or more, and I think that is a big one, as well as location. How can I get to the facility? If you're working with certain BMT patients, immune system compromised is a big one. They cannot go into gyms or pools. So a lot of public gyms are filthy. Unfortunately, that's the nature of working with or in an area where there's a high traffic volume of individuals who probably don't practice washing their hands as much as they should. In my area, it's a cardiac rehab facility. They are required to wipe down all of the equipment. It's very clean, and that's a great, safe environment that I get to see a lot more patients who have immune system issues. But just be aware of that, is that if you're going to work with somebody in a gym setting, you got to keep it clean, and you should probably carry around a sanitizing towel with you and wipe down the machine before and after, and then also try to practice that with your other patients or clients as well. There's some contraindications to exercise testing, of course. I recommend looking or buying the ACSM guidelines for exercise testing and prescription. Just for cancer survivors and specifically heart disease, acute systemic infection, fever, body aches, or swollen lymph glands, it's important to identify that you let your patients know that if you have a fever of 100 or more, it's probably a general good idea to not exercise. Typical body aches accompany those fevers. Any kind of infection is a bad idea. I want to recommend that for lymphoma or multiple myeloma patients that they stay out of a pool for up to a year of treatment. So it's important that we identify infectious areas that can cause immune system issues. But any other kind of mental or physical impairment leading to inability to exercise adequately. And these topics can generally be or generalized for cancer survivors. But with the contraindications, you're still looking for unstable angina, uncontrolled cardiac dysrhythmias, blood pressure extremely high, those types of things. And it's always a good idea during exercise testing to use the rate of perceived exertion chart, typically the Borg scale. That allows for a better indicator, in my opinion, of when to stop a test. If somebody's heart rate or their blood pressure is not responding accurately, if they're working a little bit harder, then you stop the test. Now, of course, once we do our testing guidelines from the ACSM, the FIT principle, frequency, intensity, time, and type. This applies to all patients, healthy or not. The frequency is already recommended. 5 days a week or 2 to 3 days a week of resistance training. Intensity is going to be determined by your exercise test, your testing. Your muscular strength endurance test for the resistance training can be determined through your testing. Your time, 150 minutes a week of cardiovascular exercise, 2 to 3 days a week of your resistance training. That can be probably 45 minutes or an hour and 15 minutes, 45 minutes of strength training, 15 minutes of warming up, 15 minutes of cooling down. Boom, you have your, or bam, you have your exercise program designed. And then, of course, your type. It's just watch out for public pools, watch out for public gyms. If you're in a private setting, keep it sanitized. Try to keep individuals that are having flu-like symptoms away from your patients. And then, of course, progression, and that is something that I recommend 6 to 8 weeks we adapt to our training stimulus. In my setting, we use 12 weeks pre and post test, so I recommend a 10 to 12 week pre-post test assessment to gauge your progression. This slide here is just something that I kind of throw in to give you a good idea. I tell my patients this. I also talk about this when I go do presentations for our Moving On classes at St. Luke's or our survivorship night at St. Luke's. 30 minutes is 2% of your day. Pretty small if you think about it, and that's kind of, we go back into the time. How much time do I have? Where's my time? 30 minutes, 2% of your day. I'm pretty sure you could get out there and do that. But it's also can be broken up. 10 minutes walk in the morning, 10-minute walk in the afternoon, 10-minute walk before dinner. And some of your strength training exercises. We're seeing a lot of stuff online now, at least on my Facebook post, about 7-minute intervals or 7-minute workouts, 7-minute abs. Just do something. Moving is the most important. Bottom line, individuals with cancer diagnosis should avoid physical activity as long as activity does not worsen symptoms. Daily exercise is generally safe even during intensive active therapies. As an advocate for that statement, I do work with patients who I go into the hospital room and bring them TheraBands. Getting them to move is number one importance. It's not as important as getting them a hard workout where they feel pain, or pain's a bad word, where they feel like they really got a great workout. Just getting them to move, improving their circulation, getting them off the bed. and a lot of times that's what the nurses and the physicians are going to agree with, is it changes up the monotony of treatment. Being in an infusion center, getting them to move is the most important part. I highly recommend taking part in exercise testing, prescription, and supervision. And this can, as again, will vary across the cancer experience. And that is it for my presentation on exercise testing and limitations. There's one thing that I want to let you all know, that on April 18th, I will be at the Leukemia Lymphoma Blood Cancer Conference in Portland, Oregon. If you're around there, come say hi. I'll be presenting on that Saturday at, I believe, 10:30 on exercise with a dietitian. It's called Move Well, Eat Well, Be Well. And there will also be a lot of CEU opportunities for physicians and for physiologists, and it looks like a great conference. So please join us. And then also my email address is down there in case you want to send me some questions or comments.
Thank you, Ben. I'm going to open it up for any questions. And I see one right here. And someone asked, what is the muscular strength endurance test?
The muscular strength endurance test is, well, it's based on your body weight, and it's basically how many reps you can do at that given weight. So it assesses your endurance, which is over a period of time, or how long you can do something. Like a bike ride, if you can go for a long period of time, that's muscular endurance. So say, for instance, we get a patient that comes in and does the leg press, and they're lifting 55 pounds based on their gender, body weight, and age. Based on recommendations from the Rocky Mountain Rehabilitation Institute, they're able to do 25 reps. That's a pretty long endurance that they're able to sustain through that test. Sometimes we get them to come in and they're maybe only able to do 3 or 4 of those reps. So that changes up a little bit of that. That would be more like a repetition max test. Hopefully that helps.
Okay, the next question is, what exercise testing is recommended for pediatrics? All specific.
Pediatrics, that's a great question. I do not work with pediatrics. You would have to give me a little bit of time on that one, dude. If you could send me an email, maybe we could discuss that a little bit further. But I do not know what would be a great test for pediatrics with certain types of cancer. It's going to vary across the board. You know, with what type of cancer do they have? How old are they? I mean, pediatrics is very difficult to deal with. I see a lot of patients 18 and older where we're able to do those tests, and I probably wouldn't recommend most of those tests for pediatrics. Sorry, couldn't be more helpful on that one.
All right, does anyone have any more questions? No? All right, if you guys have any more questions, you can email me, Elizabeth. I think it's actually on the registration for email you guys got. I will upload the recording of this webinar. Oh, someone else has another question. I was just going to say I'll upload the recording of this webinar and the certification for your CEU, and I'll send you guys that link sometime this afternoon. And Ben said he would provide the slides if you guys want those too. And you guys will have 30 days to have access to the webinar. So if you want to, share it or look back on it, you'll have it for about 30 days. Here's the other question. Is there norm for cancer survivor for testing?
Yes. You can look at them through the Rocky Mountain Rehabilitation Institute or the Exercise and Cancer Recovery booklet, the book, but there are also norms for older adults for some of the tests that we use as well.
Okay, does insurance cover the exercise program? That's a good question.
No, it does not. It's very difficult. From what I have been told is that cancer does not make money, and it's very poor way of looking at things, cancer actually bankrupts. And so you would think that the insurance companies would be more willing to help out with some of the rehabilitation process afterwards. But I think the research just hasn't caught up to some of the standards in the insurance company. Insurance will pay for cardiac patients to go to cardiac rehab, but what's the difference really between a cancer patient and a cardiac patient? Sometimes there isn't much, and unfortunately, insurance is not paying for rehabilitation. At our program, it's integrated medicine, so it's free to our patients, and that's something I think that is really beneficial as well. There's a big institute down called the MD Anderson down in Texas, I believe, that does a great job with their integrated medicine program. And I think sooner or later, insurance is probably going to catch up to it. I hope anyway, because they could use it.
Someone just asked, what is the 30-second chair test?
So you sit in a chair and you stand up as many times as you can in 30 seconds with good form. So it's basically simulating a squat, but with a chair.
Without using your arms?
Yes, without using your arms.
Do you provide guidelines for percent body fat for your estrogen-positive breast cancer survivors for post-treatment?
No. Our dietitians may, but I do not.
Okay. All right. I think that's it for questions. Unless anyone else have any more. Thank you, Ben. Appreciate it. It's quite entertaining. And once again, I'll send you guys the link to the recording. And if you guys have any other questions, feel free to email me or email Ben. And then we're going to have another webinar in mid-May, right before the ACSM conference. So I'll be posting that soon. Okay?
Thanks, Liz.
Thank you.